We've actually had a healthy relationship in terms of partnership and collaboration with Ipas Nigeria for a long while. And of course, a healthy partnership is what actually makes the wheel of the government keeps rolling, because you can't really do it alone. And one of our mandates in the reproductive health is to create an enabling environment that promotes universal access to comprehensive sexual and reproductive health for all Nigerians. So on those notes, I'll just want to go through the written speech that has been given to me, because I wouldn't just come here and just speak my own words. So I'll just go read exactly what has been given to me to and deliver on behalf of the Federal Ministry of Health and Social Welfare. So it's my great pleasure to welcome you all to this very important conference and stakeholders meeting with the theme Reproductive Justice, Crashing Maternal Mortality Through Reduced Unsafe Abortions. According to WHO, unsafe abortion is the termination of an unwanted pregnancy, either by persons lacking the necessary skills or in an environment lacking the minimal medical standards, or both. Nigeria has one of the highest maternal mortalities globally, and the contribution of unsafe abortion is on the increase, of course, no doubt about that. According to research done by Guttmacher Institute, an estimated 456,000 unsafe abortions are done in Nigeria every year. And that's one statistics we need to really be worried about. Every year around the world, 121 million women become pregnant when they did not intend to be. 60% of these pregnancies end in an abortion. Globally, 1 out of every 2 abortions is unsafe, putting women at risk of serious complications and death. This is preventable tragedy. Sadly, unsafe abortions are disproportionately experienced by the poor, uneducated, and rural women, making them the most vulnerable to life-threatening complications. Almost every death and injury that results from unsafe abortion could be prevented by effective contraception, the provision of safe abortion, and timely care for complications through post-abortion care. Currently, more than 50 countries permit their health systems to respond to a woman's request for abortion care, and more than 70 countries have guidelines for post-abortion care, and Nigeria is not left out. WHO supports national health system so that they can provide safe, effective contraceptive services, the post-abortion care needed to prevent and treat complications, and safe abortion care to full extent permitted to by law. In Nigeria, we all know that abortion law is actually restrictive and included in the portions of the criminal and penal codes related to miscarriage. It is, however, no doubt that the provision of quality post-abortion care in healthcare facility in Nigeria is still scarce, with access hindered by restrictions on abortion, stigma, healthcare providers, negative attitudes, and low capacity of some healthcare systems to provide post-abortion care. Hence, building the capacity of healthcare workers in the provisions of post-abortion care cannot be overemphasized, and the Federal Ministry of Health and Social Welfare, in collaboration with Ipas Nigeria, has made a remarkable achievement in this area through the conduct of several on-the-job trainings of skilled birth attendants, especially at a time where classroom training of medical professionals has been challenging, very costly, and disrupts routine activities in healthcare facilities which further compound access to quality health services. The Ending Preventive Maternal Mortality (EPMM) network has directed Africa countries for a more focused and accelerated approach towards addressing hemorrhage, preeclampsia, and unsafe abortion in a harmonized manner, knowing that these are the three major causes of maternal mortality. It is indeed a great pleasure to see that our fight against unsafe abortion is widening in scope and gaining momentum, especially from the gradual increase in reporting abortion-related data on the National Health Management Information System and DHIS2, training of medical professionals, increased partnership with international development partners, state governments, non-governmental organizations, private institutions, all working assiduously to crushing maternal mortality and morbidity related to unsafe abortion. In conclusion, let me reassure this gathering that the Federal Ministry of Health and Social Welfare is committed to the fight against unsafe abortion and improving the lives of women and girls in Nigeria. As Nigeria commemorates the International Safe Abortion Day, let us all have it at the back of our minds that crushing maternal mortality and morbidity is a collective responsibility. On this note, I would like to say, distinguished ladies and gentlemen, I thank you for listening, and may God bless you all. So that was actually the remark from the Director, Family Health Department, Federal Ministry of Health and Social Welfare. Thank you.